So we are going to do a Q&A now. So there were lots of questions coming up around everything that's relating to how we define causal and anti-causal tasks. I want to take some of this to the later roundtable discussion, because we're also getting into a slightly philosophical discussion there. And going back to the point about causality is all about making assumptions and defending those assumptions. And they are not just like falling from the sky. So you need to justify them. So I would love to have that discussion later on with everyone. I also see that our keynote speaker just arrived. Elias, welcome. Welcome to the tutorial session. So for your benefit, we just finished a discussion around how causality plays into medical imaging. And we had some very nice examples from Nick and Kai on how counterfactual image generation can be used to go beyond predictive modeling, to actually try to, for instance, generate explanations. So let me have a quick look at the questions that are coming in. I think there was one question earlier, which was actually directed to Christine, which was about counterfactual, the probabilities of counterfactuals. I think this was going back to your eating salmon example, whether we can actually compute the probabilities of something that is countered in fact and never observed. Maybe you can quickly comment on that one, and then we will talk about the other ones.
Sure, yeah, just quickly, I think it's important to distinguish between the counterfactual distributions and the observed data. So typically, we can't observe the full counterfactual distributions. And so we have to identify those probabilities by making assumptions, and then we can use our observed data to estimate distributions and causal parameters of interest.
This also relates to what's called twin networks, right, where you have your graphical model, and then you can imagine that there is this parallel world where things happen differently. And if you actually instantiate a separate network joined by the noise terms, you can do inference like that on the counterfactual variables. That just this perspective makes it very clear that the factual and counterfactual worlds are distinct.
Great. I just want to pick up one question that came in earlier, I think when Daniel was speaking about label uncertainty. And this was relating to the anti-causal scenario. How would you model label uncertainty? Why is often noisy due to both annotation and other factors? Do we worry about the uncertainty about why, whether we are in a causal or anti-causal setting? Needs some thinking, I think. My first guess would be that, I mean, generally, yes, the uncertainty around observed random variables is something you want to take into account. Whether it matters, whether we're in a causal or anti-causal setting, I'm not entirely sure. Maybe that's also something we can bring to Elias later. Daniel, I don't know if you have any other, or anyone other thoughts, Christine, Kai, and Nick.
I mean, generally speaking, we're talking about distributions anyway, right? So we are assuming that these mappings are not, although we're calling them causal, they're not necessarily deterministic, right? There's always some injection of noise. So if you remember from Nick's talk, the structural causal model, for example, which is like, let's say the gold standard that we want to reach when doing causal inference, there's always some exogenous noise, some external source of uncertainty that we inject in the model.
And then there were quite a few questions around how do we explain semi-supervised learning still to work in image segmentation. So people do obviously have seen papers coming up. I just want to mention there one reference which we will post on the chat. I don't have it in my mind immediately, but there was quite a critical perspective on semi-supervised learning in the setting of computer vision. One of the co-authors is Ian Goodfellow, where they looked at the papers and the benchmarks where semi-supervised learning was evaluated on. And they often found that the baselines weren't that appropriate in a way that if they actually set up proper baselines supervised with like exhaustive data augmentation, you often can beat a semi-supervised learning approach.
I found the reference. I'm posting the link on the...
Sure. Okay, great. thanks. Let me check again. What else do we urgently need to address? There was someone in the audience earlier raising their hand, Wilson. I don't know if that question is still on. Do you want to ask your question? If you, by the way, if you do raise your hand, we can also allow you to talk. So, I mean, it would be great to hear some people chipping in. Maybe we can take one or two more questions before we move on. Is that still on? Is that still relevant? Maybe not at the moment. Okay, we can definitely come back to any further questions. Let me just see if I missed anything. Yeah, there was an interesting one also for Daniel. So we had this plot about image segmentation, and we had the disease factor as well in there. So someone was asking about the relationship of the segmentation and the diagnosis, and whether we are missing, did we miss some errors in our graphs?
That's a great question. And yes, it is true that the radiologists don't operate in a vacuum, right? They have the images, but they also have access to the full health records of the patient, right? So they will be aware of also anti-causal factors, right? So the patient's full, background, family history, health history, treatments, diagnosis, and all of that. So in that case, it's not so clear cut. Then how is it truly just purely causal? Is it confounded by all of these other factors? So obviously, in our talk, we presented just like the very basic cases, and there can be combinations. And when multiple of these factors are combined, things are not so easy to disentangle. Yeah, so we can customize the graph or adding additional arrows, and then we can maybe potentially use causal inference, do calculus and so on to try to isolate what exactly we need to estimate if we want to remove these confounding factors.
Also, this reminds me of one thing that Sotos mentioned in his tutorial on disentanglement on Sunday, I believe, which I really liked, which was we always have to consider that images are not just taken by chance, right? So there's always an indication why you do get a medical scan. And that already means something that you do get a medical scan. So I think this is important to keep in mind. So I think in the interest of time, so I would like to close this Q&A, but remember everyone here on the panel, including our next keynote speaker, is actually available later for the roundtable discussion. And again, we would really like to hear people's questions over there. I'm handing over to Kaya now, who will make a quick introduction. I'm really looking forward to the next session. Thank you.